poorest man would not part with health for money, but the richest would gladly part with all their money for health. In doing research for this occasion, it appears there is rarely an elimination of diseases. There is usually just a learned control of the disease and a method to stop the spread of it. Unfortunately, the communities that are more vulnerable to social and economic changes are the ones that are often hit the hardest. That is the poor and disenfranchised. Community become healthy through a process that brings together the best of all the participants have to offer. That is, engage in full diversity of the members of the community and engage the community in a process of vision and goal setting. Parkland has obviously been headed in that direction. Health cannot be defined simply by the absence of disease. Mental, spiritual, and environmental well-being all play in the part of the overall health of the community. Although there is no single magic pill that provides the solution to illness, and oh, how we're all waiting for it, well, at least not yet, we look for other ways. When it comes to people's personal health concern, it often also brings fear. And to summarize, all people want to be able to trust their health provider. When there is illness and pain, people want to feel that their loved ones will be well attended and taken care of. Nothing is perfect, but with the opening of this institution, the vision continues of providing that health care and put a dent in the bringing health to the community. Thank you very much.
Pleasure now to introduce my friend, Congresswoman Eddie Bernice Johnson. Aside from being Parkland's member of Congress, you're sitting in her district now. Congresswoman Johnson is a trained nurse. Before her service in Congress, Congresswoman Johnson served as the chief psychiatric nurse at the Dallas VA Hospital. Her clinical experience gives her first-hand knowledge of what it takes to serve patients with compassion and improve their lives. She's been a steadfast supporter of Parkland, and we are so grateful for her leadership. Please join me in welcoming Congresswoman Eddie Bernice Johnson.
Good morning. I am so delighted to be here this morning, and I'm so delighted to meet every one of you. As I look through this audience, I don't see a single face that has not been involved with Parkland. And I'm grateful. I'm grateful for whatever role that you've played. You know, in August of this year will be 60 years of being a registered nurse. I'm quite old enough to vote, but 5 years later, Parkland became a part of my life. And my only child was born here as the only place in this city that he could be born. He is now grandfather. And so I'm grateful for Parkland and kept me in touch with Parkland. I am so overwhelmed with the generosity of this community and the caring and all the board members and all of the things that philanthropy has done for this city and this hospital and for the care. Dr. Anderson was my partner all the way through the state legislature and much of the Congress. And you know, we had many conversations about the load of work and the diversity of the patients. And the one thing he always left with me is that his number one care in his heart was about caring for the patients. He was not INS, he was a doctor. And he was the manager of Parkland. Parkland has meant so very much to this facility, to this city, and to this county. You know, for Parkland to care for almost 1 million patients, 1 million patients a year and have almost $1 billion uncompensated care. What else for the quality of care? And year after year after year, I would see these Newsweek magazines name Parkland one of the 10 best public hospitals in the country. I was always proud. And I've always had a partner in Congress for Parkland, my colleague, Congressman Burgess, who is a product of the medical school and doing his internship and residency right here. And I'm proud of that. Because, you know, I serve with some wonderful people. We don't always agree on a lot. But when it comes to Parkland Hospital, there's no question in my mind where I can go to get a partner. And that's Congressman Burgess. And so I'm very, very grateful. And Parkland is more than just this setting where we are. Parkland is all over this community, with all kinds of programs and supporting community groups and civic groups to make sure that quality care is delivered. And you know, the community health centers have been so good in making sure that patients get primary care, preventive information, so that they can learn to take care of themselves. This is an unusual institution. I've come out some weekends just to stop in to look at the emergency room. If you have not done that, it's an education unto itself. To see the willingness of these people and all of the healthcare providers looking out for all kinds of incidences and illnesses. I remember an incident very early in my young life. We were getting ready for church one Sunday morning, and my son was on a walker, and he rolled out the back door and rolled off the porch, and he split his lip. And of course, being that only child, my husband and I grabbed him up and we rushed out to the Parkland emergency room. And about 5 hours later, we woke him up and said, let's go home. Because the lip had gone down, the bleeding had stopped, and we realized how just important an emergency room is for an emergency. And so let me just say that there's absolutely no other healthcare facility in this nation that I care about most. And I'm so pleased that we're right here with a medical center as well, with 5 Nobel laureates that's connected and help and oversee some of the care at Parkland Hospital. We have a wonderful healthcare community. We have a wonderful community of people who care and who give, and I thank you.
I'm proud to say that our next speaker is one of our very own, a Parkland-trained physician. Before he was a congressman, Dr. Michael Burgess trained in obstetrics and gynecology here at Parkland with our current board member, Dr. Linda Parnell. Between the two, I'll bet you there's some really good stories. During his time in Congress, Dr. Burgess has distinguished himself as a demonstrated leader on a variety of healthcare issues. Dr. Burgess, too, has always been a very, very good friend of Parkland, and we're grateful to have his support. Please join me in welcoming Congressman Dr. Michael Burgess.
Okay, can you tell a Parkland trained I come up here with a yellow legal pad and notes? Dr. Parnell, I would just remind you, the statute of limitations has expired on most of the stuff. We were post officers together. And Debbie, I want to thank you for mentioning Dr. Anderson. I mean, Dr. Anderson was my resident when I was an intern at Parkland in the emergency room. So it's hard for me to think of Parkland Hospital and not think of Dr. Anderson, and surely he is missed. Dr. Cerise, congratulations. What a wonderful accomplishment. What a wonderful vision you've had for the city, and what a wonderful return on investment for the taxpayers and the donors who have made this facility possible. Thank you to the commissioners who worked and labored long hours and made certain that the budget's all lined up and that you were actually able to finally deliver on the promise. And really, thank you to what I would say is the best in Parkland: the nursing staff, the support staff, the ancillary staff, the cafeteria staff. I learned how to eat breakfast standing up in an elevator, going from the cafeteria to labor delivery. That's one of the things you learned as a house officer at Parkland. Am I right, Winfred? But the support staff was really second to none. And of course, the nursing staff is excellent. The nursing students who were here when I was here, and I know have gone on to great things. For the house staff, and I guess actually your house staff is working today. I don't see many of them here. If they were, I would say Happy Doctor's Day, because this is Doctor's Day. March the 30th of every year since 1990, signs a law passed by Congress in a bipartisan fashion, signed by H.W. Bush. So Happy Doctor's Day to our house staff. You know, we sometimes focus so much on the present, we forget about the future. Yesterday or last week, we passed a bill in Congress that actually fixed a 17-year-old problem. And it's one of the things that I have been focused on year in and year out. In fact, some of that Parkland stamina that helped me get through that process. But for the doctors of tomorrow, they don't really so much care about what we passed last week. They're interested in what's going to happen in the future. Front page of the Dallas Morning News this morning is an article about a drug that costs a lot of money. Yeah, it costs a lot of money. But when you and I were at Parkland, that disease didn't even have a name. We called it non-A, non-B hepatitis. And some wizard came up with hepatitis C. Who would have thought it? That's not curable. It's not just manageable, it's curable. That is a fantastic occurrence that has happened during our professional lifetimes. So when I talk to groups of young doctors, sure, it's easy to despair. Student debt is too high. Policies passed by the federal government are too restrictive. But you know what? This generation of doctors coming up is going to have more tools at their disposal to alleviate human suffering than any other generation of doctors has ever known. The good news is, Parkland Hospital, they're going to have a wonderful place to do it. Thank you very much for letting me do this.
It's fitting that our next speaker will be dedicating new Parkland Hospital to the people of Dallas County. In addition to serving as county judge, Clay Jenkins has been a tireless advocate for improving access to health care. And as many of you remember, he joined with Mayor Mike Rawlings to take a hands-on approach to the recent Ebola outbreak and leading Dallas through the crisis. For our final speaker of the morning, please welcome Dallas County Judge Clay Jenkins.
Well, before I get to the prepared remarks, let me say this. I am very thankful to God today. God He's the God of the valley that we've walked through for the last 5 years, and He's the God of the mountaintop that we all stand on together today. So first and foremost, I want to give thanks to God. Of all the challenges that we have faced during my time as Dallas County Judge, none has been more difficult, more time-consuming, and more important to our community than saving Parkland Hospital and ensuring quality care in this new building for generations to come. Now, arguably, my best decision as Dallas County Judge was to appoint Debbie Branson to the board of Parkland. She was twice unanimously elected by her board peers as chair of the Board of Managers, and Chairwoman Branson was named the 2014 National Hospital Trustee of the Year by Modern Healthcare magazine. I want to thank each commissioner I've had the honor of serving with for their devotion to Parkland's mission. Retired Commissioner Maureen Dickey, current commissioners Dr. Teresa Daniel, Matt Cantrell, Commissioner John Wiley Price, and Commissioner Dr. Elba Garcia. Personally and on behalf of the Commissioners Court, I want to thank former Chairwoman Dr. Lauren McDonald, former board members Dr. Roberto Dela Cruz, Ms. Kobe Russell, and Mr. Eddie Reeves, and the current board members Pat Gorman, Dr. Sherry Johnson, Jerry Bryan, Dr. Winfred Parnell, Dr. Paula Dobbs-Wiggins, Dr. Stephanie Woods, and Chairwoman Debbie Branson. A heartfelt thanks also to the late Dr. Ron Anderson, who dedicated his life to Parkland.